welcome to PhDizzle. I'm your host, Alice Chang, and today we are interviewing Dr. Daisy Shu, who got her optometry degree from the University of New South Wales in Sydney, Australia, then worked for 2 years as a clinical optometrist and got her PhD at the University of Sydney in molecular biology. And she is currently in Boston, Massachusetts, USA, completing her postdoc at Harvard Medical School. It seems like you've always been into eyes. So tell me about, I guess, your journey into optometry, like working on the clinical side, and why you chose to do your PhD.
Yeah, so I'm obsessed with the eyes. Was 9 years old or so, roundabout. And so I would visit the optometrist, and I was pretty fascinated about all the little gadgets and things, and I didn't know what was happening. And now as an optometrist, I'm like, oh my God, I know everything about what had happened to me. And I'm trying it sometimes, like, because as the patient, you see everything differently. You have all these lights shining on you. And then as the optometrist, you're shining those lights. So you get that different perspective. But now I completely understand at least what was happening to me as a child getting tested in the optometry room. Possibly that inspired me because I was just so curious and just I was like, what is this, and how am I now able to see so clearly? That was definitely important to me, sight and the visual system. And when I started optometry school, I just became more and more fascinated because I learned about all the intricacies of the ocular tissues and all the different components and how it all comes together to make this fully functional eyeball that's connected to the brain. I actually did a summer research program back in my fourth year of optometry school. Our degree was 5 years. And that was what sparked the curiosity into research. So I did this 6 months placement and at the Save Sight Institute under the supervision of Phil Madigan. She just inspired me. It was the first time I got to wear gloves, and then I was mixing things and dissecting things. And I was like, oh my God, this is so fun. And then she said, you're great at this. I was with this other girl as well, one of my good friends, and we still keep in touch today. She's still an optometrist, but it's just funny because we talk about that experience, and we recently, Facebook has these memories that pop up.
Oh, yeah.
Yeah, 10 years ago this happened. Yeah. So she recently was like, oh my God, you're a postdoc now. That's so cool. So basically, Michelle Madigan was like, you guys are amazing. You guys need to do a postdoc or a PhD when you come back. Oh. So that resonated in my mind. And when I worked as an optometrist, I was thinking about it. And then eventually I decided to pursue a PhD. I did so at the University of Sydney. But that was a great experience for me. It was actually closer to not that distance was the factor, but it was just nice to get a new perspective, a new environment, and my mentor, my supervisor, Professor Frank Lovecue, was incredible, and he inspired me. I went from not knowing anything about molecular biology, because by then I'd forgotten everything as an optometrist, from my 6 month stint back in fourth year optometry school to that point where I started my PhD. I didn't even know how to use a pipette. So I was like, what do I do?
Come so far.
I've come so far. So it was funny because we went to this retreat, and this was kind of an orientation retreat for PhD students starting out, and there were some more senior PhD students there too. But it was funny because my lab mate was like, isn't it so hilarious that Daisy doesn't know what an antibody is? Because I really didn't. I had no concept of an antibody. And now, fast forward 7 years, I've fully immersed myself in this molecular biology world. So it's been really fun.
I have a question about the clinical side of things, because you decided to go back. So I think at the time you're it was kind of always in my mind, but like pros and cons, I guess, of like clinical side versus research side. What is that like for you?
Yeah, so the clinical side is, I needed it. I needed to do those 2 years for sure, because like as a student in optometry, you basically get to see, I don't know, like 3 patients max a week in your final year. So you get like, I think one patient a week in your 4th year or 3rd year, maybe, and 4th year, and then 5th year. Basically, there's not much exposure. Yeah. So I needed like basically that practice to basically perfect and master my like optometry skills and ability to see patients, and just seeing a larger volume. Practice makes perfect. And so basically I needed to hone in on those skills. And I actually during my PhD, I still continued to work as an optometrist occasionally, and also supervise students at the University of New South Wales at the optometry school I was trained in. Oh, okay. I would supervise students, and also with being on the other side and marking them, I'm like, oh, I hate grading people. Like, it's just so difficult. But yeah, like it was quite an experience. But it was really great to give them feedback, and like I could empathize with them a lot more, because I was a super stressed optometry student. Like every time I had to see a patient, I was like, I'm so scared.
Yeah, and I feel like it's even worse if you only get like 1 patient a week, because you're like, wow, the stakes are so high for this like one person if I mess up, you know?
Yeah, it's really scary, because especially when like you might not get a patient because it's not a fully booked clinic. And then the stakes are even higher, and it's like that resistance to taking the patient because, are you up for it today? Yeah. And then like, but I won't get my numbers. So yeah, that was a constant struggle for me when I was a young girl in optometry school.
Young and innocent, but now but now you've gone through it all. So tell me about your PhD then. So you decided to go back and learn molecular biology. So what exactly did you study?
I studied how cataract forms and how we can block it from forming. So cataract is the loss of transparency of the lens in our eye. So in our eyeball, we have this lens. It's literally, I guess, like a camera lens. And it obviously needs to be transparent for light to pass through unimpeded, so that we can actually see clearly. And what happens in the aging process, and sometimes there's other stimuli to induce a cataract, like if you get hit in the eye, you could get a cataract. And if you have some sort of like health abnormalities or deficiencies in your nutrients, you can get a cataract. But generally speaking, most people, in fact everybody, will get an aging related cataract, age related nuclear cataract. And so yeah, just kind of like understanding that process of how cataracts form, how we can block it from a growth factor signaling pathway perspective. That's like a mouthful for someone who's not in molecular biology. But basically, I had to learn about signaling pathways, and that's how cells communicate with each other, which I'm like super fascinated by, because there's little molecules that can get activated, and then that can trigger a cascade of further activation. And there's a defined sequence of activation of these. Once a cell activates this signaling pathway, well, guess what? We're going to activate all these subsequent molecules. And then my PhD thesis was essentially finding the interconnections between these known signaling pathways. So there's like established pathways that cells can utilize to communicate messages and induce like some changes in cell behavior or morphology. And then to understand exactly what how these intertwine. So these signaling pathways, I found when I blocked a particular pathway, guess what? The other pathway got suppressed. So I found out that, okay, well, they must be communicating with each other. And then I would do the reverse, and then just examine the subsequent downstream effects of that.
So did you end up finding like a new pathway?
Well, I found a new connection between pathways, which is super cool. So yeah. I guess you can check out my papers.
Yeah. Oh yeah.
But, basically I did find it was very interesting actually. So I found so I play with growth factors, and growth factors are really potent inducers of responses in cells. So I work with transforming growth factor beta, or TGF-beta, and that is hugely studied. Like literally everybody, like lots of people study it because it is involved in cancer metastasis, so the spreading of cancer. And I was looking at it from more a wound healing perspective. So TGF-beta is really important in inducing this process called epithelial to mesenchymal transition, or EMT. And EMT is widely studied in that field of cancer, but in the eye, EMT is really important for healing of wounds. Now, it's fine for, like, if you get a cut on your hand, let's say it's a deep cut, well, obviously your skin cells need to come in and heal that cut. And so there is that element of EMT that gets involved where the cells, the epithelial cells, have to transform into mesenchymal cells, which have migratory properties. So epithelial cells are stationary, so they're not going to heal a wound. They have to come in, so they have to migrate to that site of injury and then contract and, you know, create these scar-like proteins so that will heal up the wound. Now, that's fine if you get a scar on your hand, because I guess cosmetically, I guess it doesn't look great, but that's fine. It's not going to induce any terrible consequences to the function of your hand per se. But in the eye, that is terrible, because our ocular tissues rely on transparency. They need to be, they can't have a scar there. So if there's a scar, light can't get through anymore. And the transparency, the reason our tissues are transparent in the eye is because of a highly ordered architecture. So these tissues are so well organized that any little disruption of this organization will stop the light from getting through, will render this cell now not transparent anymore. And so being able to understand that process of EMT in the eye, and then subsequently try to find ways of blocking that pathway so that we can inhibit the negative effects. So we want to promote the good effects. Obviously, we want to heal up the wound, but then we want to inhibit the scar formation. So then we can maintain transparency.
That's crazy, because, you know, you said TGF-beta is in so many different, I guess, diseases and, you know, for, I guess, good and bad things in the body. And it just depends on where it is and maybe how much there is, and it could totally change the outcome.
Yeah, totally, absolutely. Like, and the thing with TGF-beta is I've had like this love-hate relationship with TGF-beta because I study it all the time, right? And at first I was always like, it's a bad guy, you know, we want to block it, we want to completely inhibit its function. And then I started to think about it, and a lot of literature indicates that there are great things that TGF-beta does. So a lot of the studies that try to that kind of move into a translational phase where they do block TGF-beta, they're never successful, because you can't block something that has both good and bad completely. So that comes to question, how can we specifically target those negative downstream effects of TGF-beta? So, and that's where signaling pathways can come into play, because they are so downstream. So TGF-beta will activate its own receptor, TGF-beta receptor. There's type 1 and type 2, and then it'll activate a cascade of potential signaling pathways. So which signaling pathway is governing the negative effects, we can then isolate that, target that specifically by blocking that pathway, maintaining and preserving the good aspects of TGF-beta. Those pathways are still switched on, and then we can potentially cure that particular problem.
So you did your PhD, now you're doing a postdoc, and it's in ophthalmology. So what's the difference between optometry and ophthalmology?
Great question. My best answer to that is, like, at the core level, is surgery. Okay. Generally speaking, ophthalmologists will be very surgery heavy. There are like more physician type ophthalmologists, but essentially that's like the biggest difference. Then adding more layers of nuances of the differences, I would say an ophthalmologist would have to study medicine and then decide to specialize. To me, it's akin to a psychologist and a psychiatrist, I would say, in the sense that a psychiatrist does very similar things to a psychologist, but they are medically trained, and then they branched out into a very specific subspecialty.
So tell me, what do you study now?
Currently, I study the same process, actually, EMT. So I'm very much like EMT centric, and I study it in retinal pigment epithelial cells, and I look at how instead of growth factor signaling pathways, I'm looking at metabolic pathways now. I'm looking at how mitochondria change their morphology and their function during EMT. So it's a different spin on EMT, which is really cool.
Okay, and is that having to do with cataracts still, or in
Oh no, yeah. So now it's completely at the back of the eye now. So we're moving on to diseases also age-related macular degeneration, or AMD. That's a huge problem in the elderly population. And like cataract, we have a cure for it in the sense that we can extract the cataract and then replace it with an intraocular lens, an artificial lens implant, so cataract surgery. However, with age-related macular degeneration, there are treatments for it, but it is not perfect, and so we really do want to try and hone in on better therapies, and also if there is any damage in age-related macular degeneration, especially of a fibrotic nature, that's usually irreversible, unfortunately. So by understanding that scar formation that happens at the retina, then we could potentially possibly, amazingly, reverse that fibrosis, which would be super cool. The institute that I'm currently in is Scapin's Eye Research Institute, and there's a huge history of eye research. Literally so many amazing discoveries in eye has been originated from this place. And our library has all these really old journals of eye research journals, literally the first editions. This institute has had so much history in eye research. It's not funny.
Wow. So it's really it's just an amazing place to be, regardless of where you are in the world, right?
Yeah. If you're into eyes, it's the place to be.
It's your eye mecca. Okay.
Yeah, basically.
That's awesome. Well, I assume by doing the PhD, then doing the postdoc, and kind of going around the world and taking these 22-hour flights, you want to stay in academia?
Yeah, that is my ultimate aim, is to run my own independent research lab. That's my dream job, is to have my own lab and, have my own research, decide on my own investigations and all that. So yeah, that's my ultimate aim. Academia all the way.
That's awesome. That's good. Do you want to stay here, in the US, or do you want to go back home at some point?
Yeah, that's a good question. My mom certainly wants me to come back home. She keeps calling me. She's like, when are you coming home? So ultimately, I do think I probably will go back to Sydney. Currently, that's out of the question. I have so much to do here. But yeah, eventually, for my next transition point, probably that's my best kind of choice, I think, to be closer to my family and friends, and just reconnect with my childhood upbringing, I guess.
Full circle, right?
Yeah.
So you do, you're very heavy on the research side, but the way I found you is through Instagram, and I see you do a lot of posts around not necessarily signaling pathways, but more hey, here's me, I'm in the lab, this is me giving a presentation, science communication. So tell me a little bit about that and how that got started.
Yeah, I love social media. I'm really into it. I love posting about what's my life as a scientist, all the different activities that I get up to, and yeah, so it all started in 2017. So basically, we got this talk from this guy called Hugh Kearns. He just travels around and gives this talk, and basically the talk is how to self-promote. And I got this talk in the first year of my PhD. Oh no, the second year. Yeah, second year of my PhD. I went with my lab mate, and we rocked up to this talk in this big hall, our biggest hall at the University of Sydney. So it was like a huge turnout. And he basically said, you guys need to self-promote. You guys need to start doing it now. I was just like, okay, I need to create a Twitter account. And so I created the Twitter account. I didn't even use Twitter. So I was like, okay, I don't know what I'm doing, but I'm going to create the account because Hugh Kearns told me I should for my career. And then, so I did so, and I didn't do anything, but I did get tagged by a couple of my colleagues when I went to conferences and presented. This was like pretty early on. And then I was like, okay, I still haven't posted anything, but eventually I'll get my paper and I'm going to post that. That'll be my first amazing post.
Yeah.
Yeah. So basically, like, I think then I went to a networking event for women, and it was like women in science, and they had something about a hashtag and Twitter and something like that. And then I just went on my Twitter and I found the people who, like, I managed to get onto that, like, check that hashtag, and I started like tweeting about it, and then I interacted with all these women in this networking event. And I realized, whilst everything's happening real time, face to face at this networking event, there's a whole other world happening on Twitter that I wasn't even privy to until I opened up my Twitter and started looking. And I was like, whoa, this is so cool. There's another conversation going on, like, in the meantime. Ever since then, I've been tweeting a lot. In terms of Instagram, though, I started my Instagram account in 2018, my personal one. However, I did have a lab-specific Instagram lens research lab. That was the lab I was part of for my PhD, which I started. And so if you want to see like me before 2018, and like 2017 to 2018 me is basically on lens research lab, if you're curious.
That's so, like thing. Like I would have to do, like I would be like, oh, let me just go back to 2017. That's a lot of
yeah. So basically, like I realized that, it's equally important to have your own signed Instagram account, in addition to helping, boost up the lab Instagram account. You can also like have the same pictures on each. There's no issues with that. But eventually you are going to finish your PhD and you're going to move on to your postdoc. So it is good to establish both handles at the same time if your lab doesn't already have one. And so any students of that lab can then have access to post, any sort of photos on there if they want to. But then all the photos that you contribute, you can also use for your own personal Instagram account, and that will track your career journey.
All right, so you do science communication, you're doing research. Is there anything else, like what else do you like to do in your spare time?
In my spare time? I knew you were going to ask this question, so I have come prepared with this.
Spool of
this
thread?
Is just like
what is
cord,
it?
Macrame cord, and I was just going to show my amazing design. I just made this pillow.
Wow, I love it.
Yeah. Same.
I can't believe you made that. How long did it take?
And this one too, which is very similar.
Put it in the camera.
Yeah. Oh yeah.
Yeah, there you go.
Yay.
Yeah. How long does it take?
Like a triangular version.
How long does it take to make?
That probably the first one took me like a few days, I would say.
That's
it?
And
the second one, it doesn't take that long actually. It's really mechanical once you get what I usually do is called a square knot, and it's like so easy. It's like once, like literally you will just start doing it in your sleep. Like it's really easy. Yeah. So, but I just went online, and there's like so many tutorials on YouTube about how to make a macrame a pillow cover. So I bought the pillow cover, and then made some holes in the top, and then basically you thread the rope through, and then you just get going and then keep weaving it. And you can do any pattern you like. You can copy the patterns that are available on these YouTube tutorials, and it's just so fun. Although I must say that it does hurt your back because you're bending over constantly doing that. But so yeah, it's good to like just give yourself a bit of a stretch now and then. But other than that, like it's great.
Wow, it must be kind of like therapeutic too, because it is like you were saying, it's like a little repetitive. So it's like you can do it and kind of, it's like you're making something, like you're being productive, but you don't have to like think too much about it.
Exactly. Yeah. It's very, very good.
Are you going to be doing other things besides pillowcases?
There are wall hangings, and I was like super inspired because people literally just get a large stick from the backyard and create these beautiful like wall hangings from that. You can also buy like a ready-made perfectly like, you know, smooth stick, rod. But like you can just get like kind of that kind of like natural look by getting any sort of stick, and then it's exactly the same process. It's like so this becomes the rod and then everything hangs down from it.
PhDizzle!
Having fun with smart people who do cool things.